Hello, welcome back again. Now we have, as I said, the part 19, the eye. It says parts of the eye. We have eyebrow, eyelashes, pupil, eyelid, iris. Part B, examination of the eye. Here is an extract from a textbook description of how to examine the eye. Look for a squint or strabismus, drooping of the upper lid, or ptosis, or oscillation of the eyes, known as nystagmus. In lid lock, the upper eyelid moves irregularly instead of smoothly when the patient is asked to look down. Next, examine the pupils and note whether they are equal in size, they are regular in outline or evenly circular, they are abnormally dilated or large, or constricted, small. The fourth one, they react normally to light and accommodation or focus on new objects. To test their reaction to accommodation, ask the patient to look into the distance. Hold your finger in front of their nose and ask the patient to look at it. The eyes should come together or converge, and the pupils should constrict as the patient looks at the finger. Check also the clara or opacity of the lens. We have the part C. This one is called retinopathy. Hypertensive changes in the retina can be classified from grades 1 to 4. Grade 1, silver wiring, increase in the light reflects to the arteries only. Grade 2, grade 1 plus arteriovenous neeping, indentation of veins where they are crossed by arteries. Grade 3, grade 2 plus flame-shaped hemorrhages and cotton wool exudates. Grade 4, grade 3 plus papilledema. Here we have a little picture. It says cotton wool exudate, showing you what is this. This is a cotton wool exudate. We have now to read the exercises of this practice. Practice 19, the eye. Exercise 19.1. Complete the table with words from B, opposite, and related forms. Verb, noun, and adjective. Accommodate, accommodation, accommodative. Constricted, constriction, constricted. Converge, convergent, convergent, convergent. Convergent. Dilated, dilation, dilatation, dilated. Droop, drooping, droopy. Oscillate, oscillation, oscillating. React, reaction, reactive. 19.1. Match the pictures 1 to 6 with the conditions A to F. Look at the opposite to help you. In the first one, the answer of drooping of lids is the number 6. B, dilated pupils is 3. C, irregular pupil is 2. D, cataract is 5. E, squint is 1, and F, constricted pupils is 4. 19.3. Complete the extract from a textbook. Look at the opposite to help you. Retinoscopy. Examine the retina with ophthalmoscope is possible with the pupil dilated to obtain the maximum view. Look for papilledema and for flame-shaped hemorrhages and cotton wool exudates. Assess the state of the arteries and note the presence of any narrowing as well as neeping at intravenous crossings. Okay, 20. Oh, we'll almost finish it. 20 is always 20. The gastrointestinal system. Part A, examination of the abdomen. Here is an extract from a textbook description of how to examine the abdomen. And it says, note if the abdomen is distended by fluid or gas. The presence of fluid can be confirmed by demonstrating shifting dullness, percus, or tap. First, with the patient lying supine, flat on their back. Then ask the patient to lie on one side and percuss again. If fluid is present, the do not hurt on percussion moves. Palpate each region, feeling for tenderness, pain, or pain when touched, or masses, probable enlargement of tissue. Note also any guarding or rigidity shown by contraction of the abdominal muscles. Guarding may be due to tenderness or anxiety and can be reduced if the patient is persuaded to relax. Rigidity, however, is constant and is due to peritoneal irritation. Rebound tenderness is pain when the palpating hand is suddenly removed. It is also a sign of peritonitis. Listen to the vowel sounds. Okay, we have the part C. It is called the feces. We're gonna be reading this. Okay, so the feces, part B. There are several words for the feces. For example, doctors sometimes say, there was blood in the stools. Have you passed black stools? Patients sometimes say, my motions have been very loose lately. Bowel movement is used to refer to defecation. For example, have your bowels moved today? Have you had a bowel movement today? Bowel habit is a medical expression meaning the pattern of defecation. For example, have you noticed any change over bowel habit? How often do you open your bowels? Are you going to the toilet more often than normal? Change in bowel habit could be constipation, hard, infrequent stools, or diarrhea, frequent soft or liquid stools. Normal stools are brown in color and semi-solid and formed. The consistencies or degree of hardness and softness can be shown on a scale over here. This is a scale we're gonna be reading one by one. We have hard, formed, semi-formed, soft or loose, and liquid watery. The doctor can vary from black due to altered blood as in melemma to yellow, gray, or even white. Melemma stools are often described as cherry like tar, the black sticky substance that is used to road making. The stools may be red when fresh food is present. Blood that can only be detected with a special test is called fecal occult blood, or FOB. When there is a high fat content, the stools are pale and are sometimes described as clay color. The stools that are large in volume are described as bulky. A bad smell is described as full or offensive. Let's read now the exercises of this one. Exercise 20.1. Complete the case report. Look at A opposite to help you. Case 14. Physical examination revealed a thin girl with slight pallor. She was not obviously dehydrated. The temperature was 38 Celsius, pulse 1 per minute, blood pressure 110/80. Examination of the rest of the cardiovascular and respiratory system was normal. The abdomen was not distended. There was generalized tenderness, which was most marked in the right lower quadrant and was associated with guarding but not rigidity. There was no rebound or tenderness, and no masses were felt. Vowel sounds were reduced. Match the descriptions of the stools 1 to 6 with the conditions most likely to use them. A to F. Using your medical knowledge, look at B opposite to help you. First one, we have the type of stool and the condition. Type of stool, loose or bloody. This one is color, loose, pale, or bulky. Is irritable bowel syndrome. Clay color, obstructive jaundice. Black or cherry, gastric ulcer, small, hard, color, and clear watery with muscles is irritable bowel syndrome. 20.3. Match the features 1 to 7 to the doctor's questions A to G. Look at B opposite to help you. We have blood with heavy past black stools. Bowel habit. Are you going to the toilet more often than normal? Change in bowel habit. Are the motions hard or loose? Bulk. Is the size of the or the amount of the stool normal? Color. What about the appearance of the stools? Consistencies. How often do you open your bowels? And offensiveness. Do the motions have an unusual smell? Here we have right upper quadrant, left upper quadrant, right lower quadrant, left lower quadrant. The abdomen can be divided in 4 quadrants. We have finished with this side. It's now the turn to read the 21. This is gynecology. We have part A, B, C, and D. And next we have the exercises.